Hello, everybody, and welcome back. I am so honored and excited to have my special guest on today, Dr. Hugh Cassiere. Hi, Hugh. How are you today?
Good morning, everyone.
So, welcome. I'm so happy that you're here, and I'm going to call you Dr. Cassiere for the purposes of this time that we have together.
Okay.
Let me tell everybody, just so that they know who you are, in case they don't. You are the the chief of critical care at Northwell Health, and you're a pulmonologist,
That's
which
correct.
which makes you like a true expert on what we're going to talk about today. So we're going to talk about COVID and this whole journey of what you've been through and what you've seen. So I just want to start off a little bit, and I just want to ask you, like, yeah, you become a young doctor and you specialize and become a pulmonologist. And did you, in all this time, you've been a doctor for 29 years? I mean, is that right?
Uh, 24,
24,
but
okay.
that's long enough.
God, yes. So you never, did you ever go through any kind of experience that was even close to a pandemic? Anything that could have prepared you for what you've been through in the last 3.5, 4 months?
No, this is unlike anything you could imagine or anything that you could foresee. This is just off the charts to sound, to sound scientific. It's just surreal. Um, Nothing could prepare you. Nothing at all, at least for me. Many of me and my colleagues, we talked about it all the time going through this, for lack of a better term, horrible science fiction movie that didn't end. So there was no preparing, just, moving forward.
Yeah, it really did feel like that. That's true. So we'll start off with the despair part, and we'll take it to hope. So
Sure.
when this first happened, and you start seeing patients, like, talk us through, how you felt and what you saw, what you experienced.
Yeah, so that's interesting. So this is, I'm going to say way back. It was just March 10th. You saw the news reports about COVID. We kind of paid attention to it, really didn't realize the impact. And then my medical intensive care unit colleagues started getting patients with COVID-19. And we're a tight group, so we would talk about it. And I quickly realized that this was spinning out of control, and it was scary, for lack of a better term. And I had jumped up and asked the chairman of my department to, release me from my clinical responsibility so I can help them, because it was becoming very apparent that this was going to become larger than just one intensive care unit. And it was at the top of the roller coaster, and things just went down from there. And I know I'm rambling a lot, but there's so much caught in my head.
Yeah.
And then it was, the realization, well, I am nearly not enough. And that's when I took my entire team of 5 other critical care physicians, and we all relinquished our clinical responsibilities to join the fight against COVID-19. And we went from 1 intensive care unit to 10 intensive care units in about 5 weeks.
Wow.
We went from 18 patients with COVID-19 to over 200 critically ill COVID-19 patients, and over 1,000 patients in the hospital with COVID-19. It was just, God, words can't even describe that. And it was scary. Um, yeah, I know I'm occupying all the time, but
No, honey, you're supposed to, just so you know.
yeah. So it was, you go from, I need to jump into the fight with the virus that, every day you turn on the radio or the news and it does something different, and you see it at the bedside. And then you turn on the news and, well, the virus can live on surfaces for 5 days. And, the virus can even affect young people. And, you're worried about your patients and your colleagues, and you're petrified of bringing it home. That was just so destabilizing psychologically. I'm okay, I could take responsibility for myself, but, how do you reconcile, going down a roller coaster at 300 miles an hour and also worrying about bringing this home and hurting and killing your family. You can't even describe that emotional turmoil and all the little rituals you do to try to help prevent that. God, how many rituals,
Like what? Give us a couple. What did you actually do?
Yeah, I went to the hardware store and got canisters, spray bottles, filled them up with 50% bleach and 50% water. I would spray everything, including my shoes. I would bring separate clothes into the hospital. And when I get home, I would literally strip down naked and go directly into the laundry room and throw my clothes in the laundry and put them on hot and clean them and then change into fresh clothes. And then still have worries in the back of my mind. Wash my hands. It's just, rituals like that and what I would do with the mask and where I would keep the mask and when would I use another mask. And this is all in the throes of, taking care of patients who are, I'm pretty good at what I do. And my whole focus is taking care of the sickest of the sick patients in my world of cardiothoracic critical care. My unit was a 22-bedded ICU, and I would take care of 22 patients. Maybe 5 or 6 of them would be very, very challenging. Imagine 185 of those patients that were, pushed you to your clinical limits and clinical abilities of taking care of patients. And it was just kind of overwhelming emotionally, professionally, psychologically. God, it's just, and that was just without being able to stop. You can't stop. They just had to move forward. There were patients to take care of, and you had to help your colleagues out. I think I'd mentioned to you previously, I would have staff come up to me literally crying and falling apart that they were so fearful of getting sick and bringing their illness home for their families. I have stories of some of the nurse practitioners I work with would rent rooms in a hotel so they didn't go home for weeks. They wouldn't see their loved ones because they were petrified to bring the virus home and God forbid, harm their family members. And we would see that. We had some families, a father and son were in our intensive care unit. They were at dinner. They spread the virus around to the family and they were dying in the ICU. And there were stories like that throughout the hospital. So, it wasn't that you were worrying about it, you were seeing it.
It's real.
And that was just
What's crazy?
Paralyzing.
Yeah, what's crazy about it is normally as a doctor, you're treating a patient for something that you're not, involved in. You don't experience on the level that we did with the pandemic. You were emotionally experiencing it, you and all your staff and all the nurses and doctors and frontline workers along with us. You're having the same fears, you're having the same experience, but we got to stay home, a lot of us, but you didn't. You made the choice not to. And you could have made the choice to not go in, but you didn't. And that's what a true hero is, that you actually did that, all of you.
Thank you. Yeah, and I've taken care of patients with influenza. We've had during the influenza season, we get influenza patients, they're really sick ones who have to go on a device called ECMO, which is extracorporeal life support to keep them alive. So, it's not like we're not used to taking care of patients who have very infectious organisms, but this was every single patient in every single one of our hospital is a hospital that has just 5 ICUs. We doubled that capacity all over. And under conditions which were not optimal. It was, was it really a good environment to work in? Sometimes no, but that was the best we could do. Now the hospital and the health system did an amazing job protecting us. I never was flagged for personal protective equipment, PPE. We had enough masks, we had enough gowns and all those things to protect ourselves. But literally it was every single patient and every single room you had to go into, you had to gown up. And every time you needed to gown up, I had to stop and pause to make sure I was doing it correctly, which sounds silly, but if you miss not covering your wrist, or if you miss not covering your ears, or if you don't have the goggles on correctly, you could get infected. So just imagine that. And then you're trying to take care of people who are sicker than sick. It's just like I said, when people ask me, how do you describe what you went through? It was just a horrific science fiction movie. And you couldn't shut it off and you couldn't pause it. And we always had to be propelled forward because there was patients continually coming. It was nonstop. It was just unbelievable. And again, I'm trying to use words to describe it, but you can't. It's just, how do you describe emotions you've never had before, or feelings of fear and of the unknown, and fear of hurting patients, and fear of, is it helping? Or even the whole point of taking care of a patient and you did the best you possibly could and they died anyway. Across many patients, not just one patient. This was just I'm hoping, a once in a 500-year experience for all of us, and we don't have to deal with this again.
For sure. So, to me, it sounds like, you watch those movies and there's a triage and they just try anything to save the people because there's constant death and destruction and so many crazy things that are happening. I kind of get a visual of you guys working like that, like in the trenches, in a war. And
yeah. When it's great because we were like, every day it was like, well, the virus causes blood clots. Oh, wow, we got to fix that. Oh, the virus can affect the brain. How can we try to mitigate that? Yeah. Oh, the virus can cause limbs to be amputated. How do we deal with that? Oh, the virus causes horrific trying to pivot and focus and give care for each particular patient, depending on how the virus is affecting them. And that's just moving forward. There's no time to look back. And things just evolved very quickly, and we were trying anything we could. And in the middle of all this, also being in contact with the health system leadership about shortages. I was on a phone call twice a day. God, it was for 3 months in a row, where we talked about, do we have enough ventilators? Wow. And if we have enough ventilators, where can we bring the ventilators to make sure patients don't come into the hospital and die because we can't put them on breathing machines? It's scary.
Yeah.
That's just, do we, forget, taking care of patients, do we have enough equipment to adequately care for these patients? So that's also evolving, and it's bad enough to have sleepless nights dealing with this emotional and nightmare of this COVID-19, but also, am I going to have the equipment to take care of the patient, or they're just going to die in front of me? I'm helpless because I don't even have the ventilator. Luckily, as a health system, we tackled that, and you probably heard I came up with that BiPAP, a machine that helps patients breathe. It's not a real ventilator. That helped us. It gave a little, you want to talk about a little hope. It gave us a little hope in the middle of this, knowing that we're not going to run out of ventilators or devices to help patients. And that's a basic thing. God, we were talking about basic stuff. A ventilator is a basic thing that you use all the time. And if you don't have enough of them, patients will die within 10 to 15 minutes of not having it. That's how dramatic it was. So that was the little light at the end of the tunnel.
Yeah, it was one of the lights with you, because that's incredible. So you come up with this innovative idea and you invent something that literally saves people's lives in front of your eyes. But so what I want to ask you is, what was that pivotal moment? Because you've taken us through the despair, and I completely feel it and then what happened? Like, how did that evolve into you actually, like you said something to me yesterday that stuck in my head, you stopped being a victim, that you were able to fight back. So tell us about that. Like, what happened there?
Yeah, so the couple of things. That BiPAP thing was a real booster for me, professionally and personally. I felt like you're drowning in human despair. Not everybody died, but there was enough death to go around to just, beat you down professionally and emotionally. And we didn't even talk about the circumstances of the death. These patients were alone in a room with the door closed, with no family members, to die on their own. Now, how horrific is that?
Beyond.
And that was a lot. That was on a daily basis. That was on a daily basis. So you're living that, and these little beams of hope. The BiPAP was for me one of the first beams of hope. Oh, good. You know, we're not going to run out of ventilators to help save people. And literally 3 days after the news came out about, you know, what I did, one of the practitioners from another hospital came up to me and said, you know, Dr. Cassiere, we had I call it a surge. What's a surge? We have enough ventilators, but patients show up to the hospital in waves, and you can quickly deplete your ventilator supply. And this doctor said, you know, we used your trick. We had patients that came into the emergency room and we hooked them up to this BiPAP machine, and luckily you let everybody know. So for me, it was like, wow. Oh, wow, I did some good. And that sounds, not that I didn't think I was doing good all along, but this was a real high point for me. And it kind of revved me up to, you know, we're in for this fight. And the other ray of hope for me was I'm a medical literature junkie. What do I mean by that? God, I have no hobbies. One of my hobbies that I have is I just peruse through the medical literature all the time. All I do is read medical literature. And coincidentally, a month before the pandemic, there was a study that came out of England that looked at this drug, dexamethasone, that everybody's hearing in the literature. And what this study showed is it showed that this drug can save lives with a particular type of lung disease. And that lung disease is ARDS, acute respiratory distress syndrome. And COVID-19 causes ARDS.
God.
So I was like, well, God, you know, and it was in February 2020 that the article got published, literally a month before we were overwhelmed. And I had in the back of my mind, we should be using this drug. Now, there's a lot of people that saw that article, and not many people used the drug because the World Health Organization, WHO, and other societies came out and said not to use this medication. Do not use this medication. It could potentially make the viral infection worse. Now, what did they base this upon? They based this upon SARS-1, which was in 2003, 2004. We didn't go through that in the United States. But they said there was some, you know, literature to possibly show that steroids can hurt patients. I wasn't convinced. We didn't have anything that was really helping. And I had a few patients in my particular ICU that I managed that were literally just continuing to die. And I said, I'm going to use this drug. I think it's going to work. And I had a treatment strategy plan to help mitigate some of the adverse effects that the dexamethasone could do. And I'm not sure if you read some of these interviews. I call it my 1-2 punch. Kind of funny, but what I did is, you know, if the steroids worsen the viral infection, well, I'm going to give convalescent plasma to punch the virus down. And that was my combination. So the very first patient that I used it on, and he's been in the news, Ron Panzak. He was on the nightly news, NBC. We had a bunch of interviews. Literally 48 hours after I gave the drug to Ron, he had one of the most dramatic responses I think I've ever seen in a sick patient. He completely and utterly turned around. I was telling the family for days that you need to prepare for your husband and your dad's death. There's absolutely nothing I can do. I wish I could. I wish I could do something. Wow, you know, I gave your dad this dexamethasone, and he got, not only did he get better, he came off the ventilator. He no longer needed dialysis. He had a tracheostomy tube. He's breathing on his own. He went to acute rehab at Glen Cove. He was discharged on his wife's 65th birthday on Father's Day weekend.
Oh,
He is totally almost back to normal. So you want to say what the ray of hope was?
yeah.
That started it. And then I gave him the convalescent plasma. But that was for me the moment where I'm not a victim anymore. I found something I thought was helpful and it looked like it helped. And I ran with it. And that's where all the news kind of picked up. Why did Dr. Cassiere use dexamethasone 3 months before the article came out from Oxford? Well, that's why. So I credit my medical literature junkiism and me having no hobbies, because that's all I do. Um, and I give credit to this patient who had clearly probably the single best response to therapy I've seen. Do I think that's a coincidence? I think that's actually divine intervention. Honestly, I'm a spiritual person. I don't think it was a coincidence that someone showed me the way, and this patient's response was so dramatic. And that became my 1-2 punch. And I use it on dozens of patients. And a lot of successes, some average, and some patients it didn't work on. But at least there was something that I found that was helpful, and we kind of ran with it. There were a lot of the physicians that were skeptical because the society still came out and said, don't use steroids. Not that I don't follow guidelines and try to do, follow what the recommendations are, but they were completely wrong. And this article that's going to be published soon that shows dexamethasone saved lives kind of validates that approach. And that was the hope for me. So the BiPAP and the dexamethasone and the convalescent plasma helped gear me up to continue the fight. And, if there's going to be a round 2 with COVID-19, and I don't want to sound crass, but I'm going to kick its ass, literally, with all the knowledge we have that the virus isn't a secret anymore. We have a whole treatment strategy now to fight it. And that gives me a little, charges me up. It doesn't take away the emotional scars from the last 3 months. I don't think anything will. And the other hope and light I want to give you is, I'm a big believer in human touch, human contact, and family.
I want to ask you about that.
Yeah, and the site, you cannot get better if you are not in a good place. I'm a firm believer in that. So one of the things the nursing staff would do was bring iPads in and other devices into the rooms and turn them on for families to talk and interact with their loved ones. I'll give the example of that patient I just told you about, Ron. 3 times a day, the nursing staff would bring in an iPad, FaceTime with the family. They would sing songs, tell stories to Ron 3 times a day. 3 times a day, that room that was dark and empty was filled with love, joy, and words of encouragement. Now, he was comatose.
Oh, he has, yeah, okay. So he was comatose?
He was, so, and again, but I'm clearly convinced, and this is even before COVID, that patients can connect with that even when you think they're unconscious. And I'm a firm believer. I tell families all the time, talk to your loved ones, tell them how you feel, tell them about things that are going on, talk to them, bring them out of this. And I think that helps. And there was a lot of that. So even though there was no direct human contact, there was virtual contact, kind of like our Zoom meeting. And that was also very enlightening. Now, a lot of these things were done under bad circumstances, but there was a lot of positivity. And once the patients were starting to come out of it, you could see their eyes and how they would change when they heard their loved ones' voices. It was just really inspiring.
I mean, thank God for technology. People say that technology, took away our social contact. In fact, it did the opposite. It was the most incredible tool we've had during COVID.
Yeah, when it's funny you say that. It not only did it help, we always tell our kids to get off their phones. They're not connecting at the dinner table. Well, this is the complete opposite. this virtual contact, I think, made a huge human impact.
Yeah.
The other thing it did that we don't really talk about is you've probably seen the Microsoft Teams commercial. Uh, I'm not, again, I don't have stock in Microsoft, but Microsoft Teams is a virtual communication platform that coincidentally, again, divine intervention, I don't believe in coincidences. 3 weeks before the pandemic came out, the health system rolled out. If it were not for this communication platform, I would not be able to communicate on the fly with my other providers and strategize and help take care of these COVID-19 patients. So this virtual world.
Wait, they rolled out a new system in your hospital 3 weeks before COVID?
Yeah, about 3 weeks before Microsoft Teams rolled out to everyone. Again, no coincidence. Just like, I could list a whole bunch of things. I would say to myself, that's not a coincidence. There's someone looking over this, and I think one of the reasons why we handled you hear about the Italian experience for COVID-19. It just makes you cry when you hear about it. The experience in China. Not to minimize our experience here at North Shore and and Long Island in New York City, but we came to the challenge, and I think a lot of that had to do with just our spirit, and I'm a firm believer in that.
I couldn't agree with you more, and you're such a heart-centered doctor, which just whoever got you was so lucky. All of those patients, but even more than that. What I love about how you're talking, and we're living in a new paradigm. Like, this has shifted the whole world into a much more collaborative world, and you have been such an example of that because how you've shared information. Talk to us a little bit about how you worked with other people and how the people you wouldn't have normally worked with.
Yeah, another great question. I have relationships with other service lines. Trauma surgery, acute care surgery, neurocritical care, surgical critical care, medical critical care. We all work together, but not together as a team. What COVID-19 did was, well, we have an overwhelming number of patients who are dying. You guys need to get your act together and work together. I would work side by side with all of these teams, and it was inspiring. And I'll give you a specific example. We have an amazing neurocritical care team. What is neurocritical care? Well, if you come into the hospital with a neurologic injury, you go to a neurosurgical intensive care unit, and these clinicians are second to none in taking care of neurologic issues. That's specific for neurologic. They know other aspects of critical care, but mostly neurologic critical care. They came to bat. They said, we want to be side by side with you guys taking care of these COVID-19 patients. We'll learn quickly. And that's just a small example. I work with, two examples, two nurse practitioners who work in interventional radiology. They typically don't take care of patients. They were on the front lines with us. Plastic surgeons, colorectal surgeons, endocrinologists who take care of diabetes. I could just list so many different providers where we all came together as a team and literally divided and tried to conquer. And we all shared information. I was a roamer. What's a roamer?
What's a roamer?
Yeah, I'm a roamer. I was a roamer in this whole thing. I had so many titles, but roamer, I loved roamer. So I would help go to the other ICUs and take care of the sickest patients because of my experience. So there were some of us that would literally roam around to the other ICUs to check up on patients and other clinicians to make sure we were trying our best and doing whatever we could and bring to bear on particular patients to help them get through this. So that was another example. So we had people who weren't typically, their day jobs weren't taking care of critically ill patients. They were good, but they were supplemented by the roamers. So, and that also had its share of psychological scars. I told you a lot of these patients were challenging. Now you're being called upon to take care of the most challenging of the challenged patients. God, and I think that's where innovation comes in. and it kind of forces you to think outside the box. I'll give you another example, soon to be published. We found out that some of the reasons why these patients were very difficult to manage is they were very hypermetabolic. What do I mean by that? If you take a look at this typical ICU patient, their caloric requirements for the day are higher, maybe 2,000 calories a day. What we found out on some of these COVID-19 patients, some of these COVID-19 patients would need 6,000 calories a day.
Wow.
6,000 calories a day.
Okay.
That's and let me get my calories correct. And I'm going to use Big Mac as an example. That's 6 or 7 Big Macs just for your basal metabolic rate.
But why? What made
Yeah,
that?
we don't know. We were thinking about it because there were some things about this COVID-19 that didn't make any sense. For someone who takes care of critically ill paper, there were some things about these patients that didn't jive. Their carbon dioxide levels were very, very high. Now, carbon dioxide gets produced with metabolism. So a team of us got together, a perfusionist, a cardiac surgeon, myself, a dietitian, and a respiratory therapist, and we investigated that. And we have an article that's going to be published soon that shows that COVID-19 patients are hypermetabolic. Now, this is what I'm talking about, thinking outside the box. And then what did we do? We have another study that's hopefully going to be published. We did what's called therapeutic hypothermia. We cooled patients down. When you cool patients down, you bring their metabolic rate down. So that's just an example of some of the out of the box thinking that we did with this COVID-19 because our backs were up against the wall. We needed to do something to fight this virus. And I've been rambling a lot, so I guess you need to refocus me again, Wendy.
No, you're doing brilliant. This is all, the information you have is so important, and that it just makes me so excited about how you collaborated. Not just in your hospital with your specialists, but with everybody. And you're publishing papers and you're sharing information so that we're not in the position that we ever again that we were when this pandemic hit. So keep rambling. I love it. But I do want to go back to, you spoke about the psychological impact of this, for you and your staff. And we touched a little bit on, I want you to talk about a code lavender and then how that led to the Lavender Lounge, because that excites me so much.
Yeah, so this has been around for maybe 5 years. So what's a code lavender? You guys know code, which is a cardiac arrest in the hospital, code red. You run to the bedside, you try to resuscitate the patient. There's something called a code lavender. And what it is I'll give you a specific example. In my intensive care unit, probably about a year ago, we had a young person die unexpectedly. And it was devastating to the staff. And the staff was distraught. So we called a code lavender. And when you do that, there's a whole team that comes to the intensive care, or any area of the hospital, you can call a code lavender. And this code is to support the staff emotionally and psychologically and help us get through the emotional trauma of what we just experienced. It's really for the staff. A social worker comes, psychological support, clergy, patient care centered comes, everything to help the staff. They would bring lavender sticks, which are very soothing. I have a whole drawer full of them. When I get a little aggravated, I grab my lavender stick and I sniff it. So they bring all these things to bear to help calm the staff. And then, so they come to you. So now we have this lavender lounge where everyone in their own time will need to come to grips with what we've gone through the last couple of months. Some people sooner than others. So this lavender lounge is some place for you to go to do that. It's a quiet place. It's a place for you to reflect. It's a place for you to interact and talk about some of the emotional traumas you've been through. It's also a place just to go and sit in silence. We all deal with psychological stress and emotional stress in a different way. This lavender lounge allows you to express yourself in a whole host of ways which you feel comfortable with. And I'm very excited about it. And I know you're excited about it. You came to visit. It's just an amazing concept. And we're getting the word out because we all need to diffuse this emotional trauma. Because if you don't, it'll have long-lasting negative effects. You can turn some of this emotional and psychological trauma into a positive thing if you express it correctly, and that's where the Lavender Lounge comes in.
I am beyond excited about that idea. One of my focuses in having this wellness center is healing the healers, because I know if my healers are good, the care that any person who walks in here gets is superb. And that's what that Lavender Lounge does, and that's why I'm so excited about it. When I walked in there the other day, first of all, it was beautiful, and it had the salt lamps, which of course, look where I'm sitting. But and I know we're looking at building a salt wall there, but what I loved about it is I saw 6 or 7 people just sitting there completely relaxed. Some had headphones on, some were just listening to the music, a couple were reading, and it went straight into my heart. I was like, oh my God, here are these people who've been on the front line, who've been literally saving lives, and they have this room that they can come and they can, de-stress, and they can release some of what they're holding on, because that, like you said, if they held on to it, that could only hurt them.
Yes, yeah, and the unfortunate thing about the Lavender Lounge is we're in a temporary location, because we have to be prepared for a resurgence and a second wave, and then we'd have to use the Lavender Lounge. Before it was the Lavender Lounge, was a COVID-19 unit.
Oh my God, really?
Yeah, yeah. So it's a temporary location. It's still nice, love it. It's located literally outside of my office, a stone throw away from me. But it is it's a recognition and a place for the staff to also be appreciated. The hospital's appreciating our hard work and our sacrifice. I want to say sacrifice. A lot of it was sacrifice by helping us emotionally, not just words. Right? Actions mean more than words. And the Lavender Lounge is an amazing action that the hospital and the health system taking for us that we can capitalize on, and we will. And I'm really happy that you're involved with it as well. And a shout out to my wife, who's also involved with it.
Yeah.
She's head over heels. Cindy, she's, clinical social worker. This is her thing. So we're doing this together with Nicole Benacasa, the director of Patient Care Center, and Christine D'Alessandro, to kind of get this all together. And we'll have a permanent place once this COVID nonsense goes away. And we'll get the word out.
Oh yeah, I'm going to, that's a huge focus for me right now. But I do have one more question, well, a couple more, but this question. So, with all these antibody tests, do you think, if someone has the antibodies, have you heard that they're able to contract COVID again, or is there like a time period that they won't? Do you know anything about that?
Yeah, so this is an unknown, and there's been a lot of news reports recently. Patients can get reinfected. The immunity only lasts a couple of months. That's based upon very flimsy information. Nobody knows. We could look back, right? We can look back. If you were to get SARS, the SARS-1 virus, you would have about a year to 18 months of immunity. So we're thinking that maybe that much. There's going to be vaccines coming out. We're going to have a lot more data. And again, I'm a data junkie guy. I look at the medical literature. There's not a lot for me to fall back to kind of tell you what that's going to be. If we take a look at the common cold, which is a coronavirus, you only have a month or two of immunity. If you get the SARS-1, God forbid, you'll have a year to 18 months. I'm hoping the SARS-2, the COVID-19, is going to be something in between, where we have a little solace that we have antibodies and we're protected. But time's going to tell. Don't want to scare everybody, but I think it's going to be protective. The question is for how long.
Well, but what's amazing, and just having this conversation with you, is I see how you start off in despair, and then you invent a new piece of equipment, and you come up with all these. You have, like you said, you're going to kick COVID's ass, and that gives me such a comfort because I know that if there is a second wave, there's so many tools and so much known because someone like you, who like I get this picture of you being like this general warrior in the army, that you came in and you were like, okay, and you came up with all these plans and this treatment, and so having you doing this, it gives me comfort that we're going to be okay. That there's lots of tools. This is not unknown anymore. And thank you for being such a junkie, because if you wouldn't have looked at that study and the subsequent studies that you have, and you tried them, we wouldn't have known that there was a treatment plan for this.
Yes. I'm happy to be a junkie for literature.
We won't go into
that's my hobby. So it's either golf or medical literature. So I guess it was the medical literature.
Listen, both healthy, because there could have been much worse, habits.
Yeah.
So Dr. Cassieres, I just want I know you spoke about Ron and that incredible moment, of him like literally walking out of the hospital. Is there any other magic moment you want to share with us? Just anything personally or professionally that you felt?
Yeah, so we didn't talk about how did I undo all that psychological stress about harming my family, right? I mean, what happens to me happens to me. It's my choice. It's my profession. It's what I chose to do. I don't want to get my kids sick, or my wife Cindy sick, and God forbid, other family members. So what gave me a little hope, and this is going to sound a little silly, we got antibody tested. I'm antibody negative. How's that a good thing? Well, I was literally swimming in COVID-19, swimming. So if I did not get contracted, it means my PPE did pretty well. One of the enlightening things for me is, again, if COVID-19 comes back, not only am I going to kick its ass, I'm not going to be fearful anymore to spread it, because I know I'm well protected. And that's a very big psychological booster for me, to know that I'm coming in, taking care of patients, and I'm not going to harm my loved ones. And I think that's going to be good for everyone, not just me. I wasn't the only one feeling that. I told you in the beginning, there were nurses literally that would break down crying and immobilized in fear, and would live in, one of the nurse practitioners lived in a hotel for 6 weeks, didn't see their family. So some of that will be really helpful from the humanistic side. Not only do we have tools to kick COVID-19's ass, but we could all step back and say, if you have appropriate PPE, you're protected, and so is your family members. And that's huge for us.
That is so comforting and so important. And, just listening to your story and seeing that what the nurses and frontline workers and any support staff in the hospitals have done to literally save our lives, you creating that room, is so important, that Lavender Lounge. And for anyone who's watching, they're looking for donations to keep making this room more and more magical, to really help these people with these heroes with the psychological trauma they've been through. So I'm going to put that contact information if somebody wants to, donate anything would help, just so that we can really take care of the people who've taken care of us and our families.
Yeah, that'd be great. That would be so helpful. Again, although I feel better now, there's still so much psychological stress and emotional stress and sleepless nights still, right? It's just, we need to unwind all this. That'll take time, and Lavender Room is helpful for all of us. For
sure. I have loved talking to you, and it makes me feel like so comforted knowing that there is somebody like you in this world, as a doctor, as a human, and what you've done, and how you've changed the course of medicine in your industry with inventing, that equipment, and just being so innovative. So really, thank you, Dr. Cassieres.
Oh, thank you for your kind words.
I'm going to tell everybody how to get hold of you if they need you, because I'm sure people have lots of questions, and we're going to look for your published articles, because that's going to be very helpful. So
And I'm looking forward to visiting.
yes, come already to the cave. I'll just show anyone
Yeah.
who hasn't seen the
Yes,
cave. I know I showed you. Look how beautiful
so
it is.
jealous. I'm so jealous. I want to be there now.
I mean, talking about a space that you can totally de-stress, this is it, love. This is like your secret magic cave. Thank you for your time, love, and I hope to see you soon.
Welcome. Have a good day, everybody. Bye.
Bye, everyone.